The World Health Organization just declared the Ebola outbreak a public health emergency of international concern on Sunday. World Health Organization Director General Tedros Adhanom said in Geneva Tuesday that he is deeply concerned about the scale and speed of the epidemic, and that the UN Health Agency will convene its emergency committee Tuesday to advise on recommendations.
And because I'm deeply concerned about the scale and speed of the epidemic, we will convene the emergency committee today to advise us on temporary recommendations. So far, 30 cases have been confirmed in the DRC from the northern province of Ituri. Beyond the confirmed cases, there are more than 500 suspected cases and 130 suspected deaths. These numbers will change as field operations are scaling up, including strengthening surveillance, contact tracing, and laboratory testing. Cases have been reported in urban areas, including Kampala and the city of Goma in the DRC. Third, deaths have been reported among health workers, indicating healthcare-associated transmission. Fourth, there is significant population movement in the area.
As we speak, there's already been over 100 deaths that have been reported in the Ebola outbreak in the Democratic Republic of Congo, with more than 390 cases suspected. This is according to the information that was recently given by the head of the African Centers for Disease Control and Prevention.
The World Health Organization says they suspect around 250 cases so far and that 80 people have died, but they've warned that they believe this outbreak is actually much larger. They've labelled this emergency at its highest international alert, and it's understood the first case was traced back to around 3 weeks ago in the Democratic Republic of Congo, but that it's now already spread to Uganda. There has been several outbreaks of Ebola in recent decades, but what's different about this one is the strain. It is very rare, which means there's no vaccines, no treatments, and also no specific tests.
Currently, I'm on panic mode because people are dying. I don't have medicines, I don't have vaccine to support cancer.
So far, the World Health Organization has stopped short of calling it a pandemic, and they've also advised not to shut any borders.
So we are at a hospital where a Congolese national died after testing positive for Ebola. He came from Ituri province, that is where many people have died, and doctors tried to treat him, but it was too late. So what's happening now because of that is that the measures have been put in place. People are doing temperature checks. They're being told to wash their hands or use a sanitizer. They're being also given masks to protect themselves as well. We also know that after the death of the man, everyone who came in contact with him has been put on quarantine just to make sure.
In Kampala, I don't like to say we are safe. We are ready with our colleagues in the ministry, in Kampala City Council, with the epidemiology department. We are ready. We have the experience. Everybody is on alert. Everybody is ready.
The government has asked people to be vigilant, but also saying that everything is under control. There's no cause to worry. Uganda has dealt with such crises many times. The first Ebola outbreak happened in the year 2000, and after that there have been several other outbreaks, and the government has been very effective in dealing with such outbreaks, not just Ebola, but also things like measles. So the government has perfected how to contain such issues very, very quickly. At the border, we're being told that government officials, organizations like MSF, they're deploying there to make sure that everything is set. All of them saying that they want to make sure that situation is contained as quickly as possible.
Dr. Peter Stafford and his wife, Dr. Rebecca Stafford, working for the medical group Surge as medical missionaries, if you like. He's tested positive. His wife and 4 young children are now under observation as all 6 are being flown out of the Democratic Republic of Congo to Germany for further treatment. That's almost 500 cases there now and at least 116 deaths as medical supplies are being rushed into the area. The World Health Organization has declared this is a public health emergency of international concern. That's one step below pandemic level. Australian experts are confident it will be contained and it won't get anywhere near us, but there are concerns for that region.
Yeah, we have identified a large number of cases and deaths already, but unfortunately that appears to be the tip of the iceberg, and it seems very likely there's a lot more cases out there.
The DRC is a do not travel country based on smart traveller advice and has been for some time.
Now, the United States has already imposed a travel ban on foreigners if they've been in the DRC, Uganda or South Sudan any time in the last 3 weeks. But there's growing criticism about America's ability to help combat this lethal disease after President Trump made some aggressive budget cuts to agencies like USAID.
This virus started, or it was first identified in Bundi-Bujo, which is in Uganda, hence the name Bundi-Bujo. And this was in 2007. You might be watching this video and wondering what the Ebola virus is, what causes it, what it's about, and all that. So there is what is called the Bundi-Bujo virus. This virus is one of 6 known strains of Ebola disease. It's a severe, often fatal viral illness that spreads through direct contact with the body fluids of an infected person. This can be through the blood, vomit, sweat, urine, feces, breast milk, or semen. As a preventive measure, here are 6 things you can do to prevent yourself from contacting the Ebola virus. The first one is wash your hands often with soap and water. Then secondly, avoid contact with sick people and their fluids. Thirdly, do not handle bushmeat or sick wildlife. As you may know, you can also contact the virus from wild animals. The fourth one is avoid touching the deceased. Use trained burial teams. The fifth one, cook all meat thoroughly. And the sixth one, report fever and symptoms to a clinic immediately. Now, the Democratic Republic of Congo shares borders with many countries. Among those countries is Zambia. And the World Health Organization classifies countries bordering DRC as high risk for spread. Population movement, trade, and travel mean awareness is the first line of defense. Knowing the signs protects you, your family, and your community. So the symptoms for Ebola virus include sudden fever, severe headache and muscle pain, fatigue and weakness, vomiting and diarrhea, sore throat, unexplained bleeding or bruising. Now, these symptoms typically appear in 2 to 21 days after exposure. Well, this is it for today, ladies and gentlemen. If you enjoyed this video, as usual, please don't forget to subscribe, like, comment, and share this comment. Thank you for having taken time to watch this video. I'll see you in the next one. Peace.